Welcome to Educators Podcast. Hi, my name is Swapnil. I work as an intensivist at St. George Hospital in Sydney. And today we have a very special guest from Harvard Medical School and Mass General Hospital, Dr. Arabella Simpkin. Currently, she is in Down Under. Welcome, Arabella.
Thank you. I'm excited to be here with you.
Thanks. Good to be in the same time zone for a change.
Exactly.
So, Dr. Arabella Simpkin is a medical graduate of the University of Oxford. She trained in adult medicine and pediatrics in the UK and holds membership to the Royal College of Pediatrics and Child Health. Dr. Simpkin has a Master's of Medical Science in Medical Education from Harvard Medical School, graduating in 2016 from the inaugural class. She is the Associate Director of the Center of Educational Innovation and Scholarship at Mass General Hospital, which aims to promote medical education research for faculty and build community in this space. She is committed to designing and researching innovative approaches to the teaching of medicine, particularly in diagnostic reasoning, medical decision making, resilience, and embracing uncertainty. With this focus, Dr. Simpkin hopes to reduce burnout, increase engagement and satisfaction, and thus increase patient safety, especially looking to reduce diagnostic errors. And today is my quite honor and privilege to discuss a very unique topic with her, that is uncertainty in MedEd. So, Arabella, first of all, thank you for agreeing to do this podcast, and I'm very much looking forward to listening your thoughts.
My pleasure. I think there's no doubt this whole area of uncertainty is becoming increasingly topical and sort of increasingly timely. So it's a pleasure to be here to discuss this with you today.
Okay, so let's start with first question. Obviously, we are all curious to know about what ambiguity means to you, especially in the context of medical education.
Yeah, I mean, I think this is an excellent question. I think there's no doubt that uncertainty and ambiguity is around us on a daily basis. And certainly the medical space is no exception to that. And in many ways, I think most of the decisions that we make, we are having to do in an environment that is rife with uncertainty. And as I went through my training, I began to sort of recognize that in many ways, we often paint a picture of certainty. We have an education system and a culture that really rewards and prioritizes certainty. And as I became more senior in my training, sort of on the shop floor, as it were, in the healthcare environment, I began to recognize how much uncertainty there is. And yet more and more felt that perhaps we sort of naively at times try and decipher the world in black and white. And so I became very interested in thinking about how uncertainty affects us, both our own well-being and also our decision-making.
That's quite fascinating. I agree with you that medicine we should know the answer to the questions. If we don't know the answer to the question, that is taken as either you are dumb or you need to go and study more. So I think embracing this uncertainty or ambiguity is okay, and that's quite interesting.
Right. No, exactly. I mean, I have to say, I think, very much this sort of idea of saying, I don't know, historically in medicine, I think has been somewhere we've shied away from. I think we have had a culture that it has too often equated uncertainty with ignorance or failure. And I think in many ways, the sort of renewed landscape of really embracing uncertainty and talking openly about what we don't know is a direction that medicine's undoubtedly going in. In some ways, I think, Swapnil, that this fits also with the focus on psychological safety, on this idea of really making sure we have a culture where we feel it's okay to be open and vulnerable, clearly prioritizing patient safety and the well-being of ourselves and our colleagues.
Thank you. And that's kind of nice segue into the next question because as an educator, we encounter several areas which are not black and white. They're often come into that gray zone. And often I struggle to deal with them. As an educator, how do you deal with them?
Yes, great question. I mean, I think sort of saying that you struggle with those areas that are not so black and white is fundamental to our evolution as humans. So when you look back at our sort of evolutionary past, recognizing that we in many ways sort of change on a millennial timescale, we have sort of, it makes sense that we would prioritize and go towards those things that are certain. They haven't killed us yet. We should feel comfortable in the familiar. And I think in medical education and as an educator, we see all too often trainees having this same struggle with uncertainty. And I think in particular at junior levels, it's often hard to know what are the known unknowns and what are the unknown unknowns. And I think that's where it can feel a little terrifying to say, I don't know, because you risk feeling that you're admitting to some level of incompetence. I think in many ways, the first sort of step to beginning to deal with uncertainty is actually just acknowledging it. So I think that sort of first reflection on thinking about how uncertainty makes you feel. Now, for most of us, that differs depending on the scenario, on the sort of stakes. How high are the stakes if we get it sort of in inverted commas wrong? But I think really paying attention to the emotions and the feelings that come up when you're in a space of uncertainty is the critical first step in learning to deal with areas that are not black and white.
Okay, and that reminds me the book by Catherine Schulz, Being Wrong, where she says basically sometimes being wrong is okay because wrong is a very subjective terminology. And I think in medicine we have developed this culture where we have to be right. I think it kind of answered that quite nicely as an educator how we should deal with it.
Well, especially I would just say as we look at, how heterogeneous and individual patients are. And I think too often when we're learning medicine, we sort of rightly so learn the foundational principles and the sort of textbook cases in inverted commas. But in many ways, often, what is wrong with the patient, what is the matter with the patient may not be what matters to the patient. And sort of recognizing those nuances of trying to unpick and sort of really embrace the grayscale narrative, I think is increasingly important. And I think in that, as we learn how to deal with uncertainty, and recognize the effect it has on us, we have to also recognize as we strive to get out of the space of uncertainty, there is a real danger of premature closure, of us wanting to close down to be sort of in inverted commas certain. And the risk of succumbing then to our cognitive biases is huge. So I think it's sort of parallel of both recognizing what feelings you have when you're encountering uncertainty, but also recognizing the real dangers that occur if we don't sit comfortably in this space of uncertainty to really make sure we are minimizing our blind spot.
That's such a great answer. Thank you. Now, just to dive a bit deeper into this concept, now the intolerance of ambiguity is the perception of ambiguous situation as a threat, and you kind of alluded to this in your previous answers. Now, do you see it in the same way, or do you think that ambiguity can be helpful in medical education?
I think there's no doubt that ambiguity not only can be helpful, but is actually completely critical to driving forwards healthcare in the best possible way to deliver the highest quality patient care. I think that, uncertainty in many ways is driven by curiosity. Those two go hand in hand and really open up our sort of senses and our imagination as we look to discover and unpack what's wrong with patients. I think one of the biggest dangers when we think about uncertainty is to see it as a threat and rather than seeing it as a surmountable challenge. And I think reframing it in that way is undoubtedly beneficial. It sort of in many ways fits with the sort of idea of resilience. And we did a study actually where we looked at pediatric residents across North America and saw a very strong correlation that the more resilient the residents were, the less stressed they were by uncertainty. So I think really beginning to reframe ambiguous situations and actually seeing them as this real sort of driver of curiosity. So many of us go into medicine really with this sort of desire for continual learning, for lifelong learning, to sort of make the world a better place. And I think really seeing ambiguity actually as a critical partner in that is one of the best ways that we can recognize actually how helpful and how driving it is for medical education.
Again, that's such a great answer. And I like the relation that you're drawn between the curiosity and ambiguity or uncertainty is so vital. Now, as a medical educator, do you think that, or do you agree that we should argue for a pedagogy that includes the education in the importance of and the tolerance of ambiguity that is inherent in the medical education and practice?
Yes, I do. I mean, I think actually what's very heartening is that increasingly medical bodies and organizations around the world are recognizing this. And it's now seen as a competency, both recognized by the GMC in the UK and the ACGME in the States. This ability to recognize that ambiguity and embracing ambiguity is critical for our medical education. So I think there's no doubt that beginning to embed the embracing of uncertainty into our curricula at early stages is essential. I mean, I would argue actually for starting much sooner, even in sort of elementary school. I think when you look at the way our education system is tiered, you begin to see that we sort of set up this unconscious culture that subjects like maths and science are often prioritized higher than subjects like art and drama. You know, subjects that in a way connote a sense of certainty are seen as being sort of higher up the sort of architecture than subjects that really embrace uncertainty. And I think starting at an early level of shifting that culture, especially as we move into a world where really anything that's black and white and anything that you can program an algorithm for, the machines will take over. And so I think as humans, our value is really going to lie in this grayscale space, in this space of embracing uncertainty. And I think shifting both our pedagogy, our curriculum, but also our assessment. You know, as you know, assessment really drives learning. And I think at the moment we have too heavy weighting on sort of multiple choice questions that often denote there is a right or a wrong answer. And I think one of the first challenges for us in this space is going to be to begin to shift some of the way we assess so that we really are focusing on the sort of space of uncertainty. I think art and the humanities is really an excellent way to begin to build that into curricula. It really sort of epitomizes embracing uncertainty.
That's a very valuable answer, and I think there are a lot of hidden pearls in that answer that everybody as an educator needs to reflect upon. Now, I remember the TED talk by Ken Robinson where he says that in the current culture of the schooling or education, we are basically killing the curiosity, and we are kind of producing these robots who are trying to achieve 100% marks in each subject, and obviously that's not going to be helpful in future because we are killing the curiosity and creativity.
Yes, definitely. I think there's no doubt that, you know, especially in the age that we live in now, where the technology around us is accelerating sort of at exponential rates, I think we live in danger of a widening mismatch between expectation and reality, where too often we're sort of looking at black and white screens. I mean, one of the challenges I think we have in the healthcare space with the electronic health records and the move to documenting everything in a computer is that too often we have to translate the patient's grayscale narrative into drop down black and white boxes. And I think that's really a challenge and only serves to inculcate a notion that we sort of can neatly package everything up. I mean, I often say, you know, there must be 87,000 ICD codes. There is no ICD code for I don't know. You know, there's no billing code for I don't know. I think too often our sort of culture sets us up with this expectation that things can be neatly packaged.
One other thing that you mentioned about increasing shift towards using the arts and humanities in medicine as well. Can you tell us more about how that can be useful to embrace uncertainty in medical education?
Yes, I think there's no doubt that the humanities and art is an excellent way to really embrace uncertainty as well as really honing observational skills, skills of communication, skills of empathy. I mean, I think the list is nearly endless on the real benefit that art has. And I think when you look back at many of the great medical educators and physicians of the past, there was a real recognition that medicine really is an art and a science, and ensuring that we stay true to the recognition of both of those parts. I think art in many ways serves as a really nice way to think about uncertainty because, in many ways, although we often can guess at what the artist had in mind, there's a lot of individual perception, there's a lot of individual thought in how a picture or a poem or a words, stories, narratives, how we translate that perception into an understanding. And I think sitting for time with pieces of art, with pieces of literature, can be a really nice way to look at the numerous hidden meanings and to recognize that too often, if we close down too soon and go into premature decision making, we can risk missing a whole other picture that sits there. And I think it can be a really nice way for us to reflect on our own cognitive biases, on our own hidden assumptions that come from our backgrounds and our experiences to date. And so I think the humanities is an imperative way for us to be embracing uncertainty and building this real notion of sitting comfortably in a space where the, in inverted commas, right answer is not necessarily known.
Thank you. And one of the things that you mentioned about the study that you did, and where you kind of had a strong correlation between the uncertainty and resilience. Now, in order to interpret in opposite way, that means if the people are more uncertain, they're high risk of burning out. Now, how do you suggest that we can tackle this problem? Because burnout is a kind of buzzword for this decade, and everybody's trying to find different ways to reduce the burnout.
Right. Well, I think, as you say, what we found a very strong correlation between stress from uncertainty and burnout, which, makes intuitive sense. And certainly anecdotally, having spent a lot of time at the front line of patient care, there's no doubt in looking at colleagues, those who struggle with uncertainty really often struggle given there is so much uncertainty in medicine. I think what is very heartening is that we know that tolerance of uncertainty is a state, not a trait. So it is modifiable. You can learn to be more tolerant of uncertainty. And as we said earlier, I think one of the first things that I would encourage everybody to do is to really sit and think about where your own tolerance of uncertainty is. How does being in an uncertain space make you feel? I think one of the critical pieces for us as educators is to help begin to shift a culture, to really ensure that teams talk explicitly about where uncertainty is and about how to manage it. We do this all the time in medicine. We safety net, we create follow-up plans, but talking explicitly about where uncertainty is and how we're managing it, talking about when we don't know, setting up a psychologically safe space for us to really embrace uncertainty together, I think is critical. And I think in many ways it's heartening, that, as you say, burnout is the sort of buzzword of this decade, if not previous decades as well, but certainly is an increasingly topical area. And yet I think we struggle to really know how best to manage it. And undoubtedly, I feel very strongly that if we can learn to help our trainees and ourselves sit more comfortably with uncertainty, but still make decisions in the space of uncertainty. I think it is important to sort of recognize that we're never going to get rid of uncertainty. And so at some point, we have to be able to make a decision in its presence. But I think having these open conversations is really critical.
And just to kind of out of interest, like obviously looking from the patient perspective, every patient wants to go to the doctor who knows answers to everything. If we are promoting this culture of uncertainty within the medicine, do you think there will be some implications in regards to the patient care?
Yeah, I'm so glad you brought this up, Swapnil, because in many ways, I think this is one of the other critical pieces that underlies the culture and underlies how we should best tackle a greater acknowledgement and embracement of uncertainty. There's no doubt that patients, I think often come to the doctor wanting the certainty, wanting to know what the diagnosis is, what the management plan should be. And whilst clearly I think that is a goal we are aiming for, I think there's no doubt that as we move to an era of true shared decision making, the cornerstone of good medical practice, I think we do have to recognize that we authentically as physicians need to be able to acknowledge and discuss uncertainty. I think one of the challenges for us is in shifting this culture and in the widening gap between expectation and reality. I think the latter half of the last century saw a lot of drive in many ways towards creating more certainty, but with the advent of molecular genomics and, more recently, biomedical artificial intelligence and precision medicine, evidence-based medicine, all of these terms can sound very precise and certain. And I think it is important to recognize that whilst on a population level, I think there's no doubt we sort of increase our knowledge and in many ways maybe our certainty as we look at population level findings. Often to the individual patient, it's still binary whether they do or don't get the side effect. And I think recognizing that and discussing uncertainty openly, but also recognizing that the patients too often have the same inherent discomfort with uncertainty that we do as physicians. And I think there's no doubt that in the future, it would be nice to be able to work out where somebody's tolerance of uncertainty is so that we can best help guide a very strong patient provider relationship. We know that as trust increases in the patient provider relationship, there are better healthcare outcomes. And it's been shown actually that when providers say to patients, I don't know, that often increases trust. And I think a lot of it, Swapnil, is about teaching the right communication. So, saying, I don't know, but I'll be with you on this journey. I don't know, but we're going to discover this together. I think sort of acknowledging to the patient that you're going to be there with them is very powerful.
Yeah, that's such a great tip for all the budding doctors that uh, we are together in the journey along with the patient. I think that's such a powerful statement. So thanks for sharing that. Also, you mentioned about assessment part and having the uncertainty in assessment can be useful. And I just wonder sometimes because the medical world is kind of complex because in order to progress in your career, you need to have assessment. You need to filter out people so that certain number of people can progress in their career. How do you think the uncertainty or ambiguity will fit into assessment process given that we already designed this kind of complex process?
Right. I think that's an excellent point. I think in many ways, I see the sort of tolerance of uncertainty as being a piece, but not the sole piece of an assessment mechanism. There's an argument that we should be looking actually at tolerance of uncertainty even in our application processes to medical school. I think there's no doubt that questions that start with how or why really begin to get at a notion that there's not one correct answer. Questions that start what or when often do denote that there's a sort of set answer. And I think even just shifting when we are educating by the bedside or in the classroom setting, I think shifting how we frame questions as educators is a great first step in beginning to move the needle. But I think it is a challenge. I think especially in an age of computer marked assessments, multiple choice questions are very appealing. They're time efficient. And I think thinking about how we make sure we are prioritizing the space of uncertainty in our assessments is going to be critical.
I agree. I think that, again, that's a very valuable piece. Now, I'm becoming more certain about uncertainty that I should be uncertain more often rather than few times. What's your advice to budding educators?
I would encourage all budding educators to think about embracing uncertainty in a sort of variety of ways. First, thinking about how you yourself embrace uncertainty, understanding your gut reaction to uncertainty, thinking about how different scenarios make you feel, and also identifying your own cognitive biases. One of the real dangers as we strive for certainty is that we close down on our decision making too soon and we push stuff into our blind spot that doesn't fit. And so I think for any educator, working out where they sit and where their biases are is critical. I think the next critical step for any budding educator is to think about how you help guide students and trainees and indeed colleagues. How do you set the culture? How can you best role model embracing the inherent uncertainty of clinical medicine? How can you really ensure that you create an environment of psychological safety, that you create an environment where it's safe for people to say, I don't know, where it's safe for people to discuss insecurities and vulnerabilities and still feel respected? Where you really are promoting curiosity over certainty. And I think that is critical. I think also advocating as an educator to formally begin to integrate uncertainty into medical education curricula is a key part. And then I would end by saying the other critical endeavor as educators is to really then think about how we can help our patients and the healthcare system embrace uncertainty. And in many ways, that starts with discussing uncertainty openly with patients and using patients as allies in the shared decision-making process, but also really advocating for healthcare systems infrastructure to support embracing uncertainty, to sort of begin to recognize that actually having as a critical part of the history taking an acknowledgement of where uncertainty is, I would say is going to be vital for us as we move forwards in the 21st century.
Great. That's such a great advice. And just to kind of help our listeners, is there any kind of key literature on this topic that you will recommend so that they can go and read about it?
Swapnil, increasingly, this whole area of uncertainty is really growing. And I think there are several studies coming out in the medical space, but also actually in other industries. Two industries that have fascinated me particularly over the years are both the military and the aviation industries, who both really have focused for a long time on how to help their employees be able to make difficult decisions in the face of uncertainty. And so I think often also broadening where we look as medical educators and looking at how other industries cope with these same challenges of having to embrace uncertainty in a rapidly changing world is really a place I would encourage. I would encourage listeners to look to.
Sure. Thanks, Arabella. It was pleasure talking to you. And on such a complex topics, you enlightened us with all your insights into this topic. And this is really going to be very helpful for all of us to embrace uncertainty in the future. Thank you very much.
Oh, my absolute pleasure, Swapnil. It's a topic that really is close to my heart, and I feel is going to be increasingly important that we all really learn to embrace uncertainty as best we can for the benefit of ourselves, our colleagues, our trainees, and of course, our patients.
Thank you. Hope you enjoy your rest of time in Melbourne, and I'll see you in Boston soon.
Thanks, Swapnil.